Welcome back to the Better Health Now podcast. Today, I sit down and talk with Dr. Bullard, a board-certified pulmonologist here at Cullman Regional. Thank you so much for joining me.
Oh, it's great to be here. Thanks for asking me.
I'm excited to talk a little bit about the topic of pneumonia. But before we dive into that topic, let's talk a little bit about your background. Talk a little bit about where you decided to kind of pursue your undergraduate to then go to even into medical school and pursue medicine.
Okay. Well, my journey into medicine started way back. I initially thought I wanted to be a veterinarian, and I actually worked for a veterinarian in high school. And he said, as much interest as you display, you should think about working on humans. So I pursued that, and that's essentially how I got here. I trained, first of all, my undergraduate was at Spring Hill College in Mobile, and after that, did not locate anywhere else. I had an opportunity to go to the University of South Alabama. And so I went there for not only my medical school, but also for internal medicine residency and pulmonary medicine and pulmonary disease fellowship. And so I stayed in the Mobile area for years. I had a practice in Fairhope, Alabama, for almost 12 years before this opportunity became available and moved up here in 2021.
Okay. And so are you originally from Alabama in general, or like where did you kind of grow up?
I grew up in Mobile.
You grew up in Mobile. Okay.
Yes.
Wow. So like Mobile was home for such a long time, and then you come here to Cullman to kind of continue your career here.
Correct. Dr. Elizabeth Wheeler is a hospitalist here, and she and I went to medical school together in and around the time that the COVID pandemic became it hit its peak point. Coincidentally, the practice that I was in dissolved and the opportunity to come up here. And so I thought it was a great opportunity, and it has been wonderful living here and serving this community.
Yeah. So diving into the topic of pneumonia, I mean, there's often more than 1 million hospitalizations and over 50,000 deaths each year from pneumonia. Before we kind of talk a little bit about, maybe how like the symptoms of pneumonia and what to look for and how to treat it, first kind of define what pneumonia is.
So pneumonia is an infection of the deep lung tissue itself, specifically the alveolar sacs. The airways that lead to the alveolar sacs starts off with the trachea, the main airway, the windpipe, and that branches into the right and left lungs. And that continues to branch 23 different times into smaller and smaller subdivisions until it gets to the actual working part of the lung, which is the alveolus. There are an estimated 500 million alveoli in most human lungs. And it's a microscopic sac. If you were to imagine a cluster of grapes, the stem of the grapes would be the terminal bronchiole. And so the terminal airway, the very last airway leading down into the sac, the alveolar sacs become infected themselves. If it's if it's the smaller airways, that's bronchiolitis, whereas the larger airways, the bronchi, that would be bronchitis. And typically bronchiolitis are not as severe as pneumonia. But pneumonia occurs whenever the superficial, the lining cells of the alveoli become infected with pneumonia, which can be viral, fungal, bacterial, but it's infected with some kind of a germ. And the alveolar sacs that are normally full of air, they fill up with pus, which is a mixture of bacteria and inflammatory cells. And that is what ultimately causes deep lung infection or pneumonia.
Wow. And so the sort of the stages is can bronchitis then grow into pneumonia, and can all the other because it seemed like it's sort of like a stair stepper effect where it's, if it gets to this far, it can be this. If it gets this far, it can be this. But if it gets all the way, it's pneumonia. So if untreated any of the other things, does it often lead to pneumonia?
It often does. Some cases of bronchitis, many cases of bronchitis do not lead to pneumonia, but oftentimes it does. And there are a number of different factors that play a part of the development of pneumonia.
Okay. And so is there a certain time of the year where the symptoms and cases of pneumonia are peak? And kind of like what does that either look like on your end, kind of treating patients, and also kind of what does these the patients you deal with that maybe, or anyone listening that's trying to avoid getting pneumonia, what are some of the things that they can kind of avoid during that time of the year?
So pneumonia occurs throughout the year. There is typically a peak season in the cooler in the winter months, and there's a number of reasons that go into why that occurs. Perhaps the most common is that the incidence of viral infection seems to peak during the winter. And there's a number of reasons for that, but oftentimes pneumonia follows a viral respiratory illness, and it sometimes is a consequence of having a viral infection, and they go hand in hand. Not all episodes of viral respiratory infections lead to pneumonia, but it is certainly a predisposing factor that makes you at more risk. So it tends to occur whenever influenza is at its peak. And there are a number of other viruses, of course, COVID, RSV, and there are many other coronaviruses that affect the respiratory system, but it tends to peak in the cooler months, the same time that influenza peaks.
And so is there a, do you see a typical age range with patients that are most affected or have a higher chance of getting pneumonia versus others? Or can it occur at anybody at any stage in their life?
So it can occur with anyone at any stage in their life. There are a number of risk factors that make you more susceptible to it. Infants and young children that have not yet developed a strong immunity are at increased risk. Older adults, roughly 65 and older, because as we get older, our immune system is not as strong as it was. There's a number of different reasons, but our immunity kind of wanes, and as our immunity weakens, we are more predisposed to infections. There's a number of different factors that also can predispose to pneumonia, including other comorbidities, chronic conditions, especially chronic lung diseases, including asthma, chronic bronchitis, emphysema, COPD, bronchiectasis, plus heart disease, congestive heart failure, and coronary artery disease, along with other different chronic conditions, including diabetes mellitus, both type 1 and type 2, chronic kidney disease, chronic liver disease, people that smoke cigarettes, and now there has been a stronger association with electronic cigarette use and vaping, alcoholism and drug use, and even in people that take prescription opiate narcotics and sedative medications. Those medications decrease the cough reflex and predispose to aspiration. Other patient factors, including those that have problems with swallowing difficulty and that have significant risk factors that increase the risk that they can aspirate. So there's a lot of different things that factor into increasing your risk for pneumonia, but definitely if you're old or young, and definitely if you have significant underlying chronic conditions.
And so when you're working with patients or you're treating patients for pneumonia, is there different stages of the pneumonia that patients have, and the severity at which, if untreated or not treated promptly, could kind of increase the severity of all their symptoms?
Insofar as stages, it's hard to define whether or not there are particular stages. However, severity, yes. And that in and of itself is dependent upon a person's immunity and other chronic conditions. And it also depends on what type of pneumonia they have, bacterial versus fungal versus viral. The severity of pneumonia can be very mild for some, quote, walking pneumonia, which is usually caused by what we call atypical bacteria. That tends to be milder, and sometimes people may only have a cough and just feel a little bit down and not necessarily even have fever. That is typically self-limiting, usually gets better with antibiotics, but if you have a relatively normal immune system, people will get over that on its own.
Yeah.
But particularly viral pneumonias or if you have an impaired immune system, such as from an HIV infection or such as from those people that are on chronic immunosuppressive therapy, chronic steroids, or some of the new immune regulating medicines, such as for vasculitis or for ulcerative colitis, Crohn's disease, other types of rheumatoid arthritis, lupus, that are on medicines that suppress the immune system, that predisposes you to an infection because the immune system is being suppressed so as to